Hey there, today we'll be covering alpha lipoic acid. My name is Casey Greene. I'm a pharmacist and certified functional medicine practitioner specialized in nutrition. So we'll cover what exactly is alpha lipoic acid, what are the clinical uses and benefits you can use it for in yourself or patients, how do you give it for best safety and efficacy, how do you test and monitor, as well as common side effects and precautions to look out for, and then popular clinic protocols that can actually help you get started and best serve your patients. So what is alpha lipoic acid? So at its core, it's a sulfur-based fatty acid compound. It's highly known for its antioxidant activity, which is involved in almost every mechanism and pathway that it works in. It's also a cofactor for mitochondrial enzymes, as well as other enzymes related to sugar metabolism. It's a chelator to some degree, and it's in its oxidized form most of the time as supplemented, and notably dihydrolipoic acid is the reduced form. So how does it work? This kind of shows the major pathways through which it works, and we'll get deeper into these as we go. So at the top you've got its antioxidant effect, a regeneration of other antioxidants, so supporting glutathione and other antioxidant regeneration as well, and reparation of oxidized proteins. Then you've got glucose and lipid metabolism, which we'll get heavily into, as alpha lipoic acid is heavily used for improving insulin sensitivity, various areas of diabetic therapy and weight control. Then it can also be a chelator of metal ions of various sorts to different affinities. And then it has a great overall anti-inflammatory effect through inhibition of NF-kappa B. So how does it work? For starters, it's an insulin mimetic and reduces insulin resistance through multiple mechanisms by manipulating, upregulating, and downregulating various enzymes related to glucose metabolism. And then through inhibition of NF-kappa B activation, it greatly reduces overall inflammation, helping various types of health in the body, insulin sensitivity, blood sugar control, weight control, and many things that are offset by high chronic inflammation in the body. So here you can see three pathways. They're actually not completely separate, but for simplicity, this graph separates them into three paths. But they're all involved in high blood sugar, so hyperglycemia at the top, all the way down to various disorders caused by oxidative stress, which can contribute to any chronic disease, and then diabetic neuropathy as one, of course, major symptom of diabetes and insulin resistance down at the bottom right. And so this slide gives a good overview of the root mechanism behind how high blood sugar contributes to diabetic neuropathy. So by supporting several areas of this flow, alpha lipoic acid provides many ways to support blood sugar control and neuropathy. So again, even though all three pathways are intertwined, on the left we've got the oxidative pathway, which of course ALA acts as an antioxidant and supports that pathway through multiple areas. Then we've got in the middle vasodilation versus inflammation affecting blood pressure related pathways, which are also intertwined in the whole cardiometabolic picture. And then on the right, we've got the sugar pathway more directly involved in nerve health and neuropathy. And you can see by too much blood sugar out of control, high A1C over time, you basically decrease myoinositol and you lower basically nerve growth factor and overall support of nerve health. So nerve health can start to degenerate, have pain and numbness, and those types of issues there. Which again, ALA works in many areas of all of these pathways, so potentially very useful. So how does it work? So increased insulin sensitivity, which is at the core of blood sugar control and really a lot of what makes many people have issues with weight control in general versus other people who don't struggle as much with appetite and weight control. So it activates AMPK in skeletal muscle and reduces triglyceride accumulation in skeletal muscle. So through those mechanisms and a few others, including the antioxidant activity, it can increase insulin sensitivity, so therefore better getting blood sugar into the cells and out of the bloodstream in excess where can become overly glycated and, of course, cause issues with circulation and cardiovascular issues. And then tied into that, it can highly help support reducing body weight, again, through improved insulin resistance in obesity specifically, and increased insulin-stimulated glucose disposal, and even increased fatty acid oxidation, so the actual burning of fat, it supports that pathway as well. So studies have shown that ALA is able to sustain glucose homeostasis and prevent development of even non-alcoholic fatty liver disease. Since we think of the pancreas in highly regulating insulin and glucose, but the liver plays just as much of a role. So even independently of all control groups, even on metformin in a study, for example, even with metformin factored in, ALA dose was independently able to affect all metabolic parameters in the study and significantly reduce fatty diet-induced hyperglycemia and insulin resistance. And alpha-lipoic acid was even shown to lower liver glucose production, promote glycogen synthesis, as well as glucose utilization in the liver. All of these, of course, are factors we want when it comes to sugar metabolism and weight control. It does this through upregulating glycolytic enzymes GCK, HK1, PK, and glycogen synthesis enzyme GS, as well as by downregulating gluconeogenic enzymes PEPCK and G6PAs. This results again in lowered glucose production and increased glycogen synthesis in the liver. So a ton of benefits and mechanisms behind how alpha-lipoic acid works. So which form to use? Only R alpha-lipoic acid is made in the body, and also it's the only form used as a cofactor in those mitochondrial processes, for example. But clinical research has used almost entirely the racemic mixture of ALA, just to note. And oral ALA, significant blood serum increases are seen mostly by use of the R form. But when it comes to IV alpha-lipoic acid, there's really no difference seen by one form versus the other. But again, most forms supplemented or used in various therapies will be the racemic form. So clinical support uses and benefits. So here's the big group, and I've got these all together because they're so interlinked that it's hard to even separate them. But we've got insulin sensitivity, which of course is probably what most Americans have to some degree, but at a severe level is what of course leads into diabetes, type 2 diabetes more specifically, and neuropathy down that pathway. But then it supports weight loss because again, weight control is heavily tied into this whole insulin sensitivity and blood sugar control pathway. So it's important to note that most treatments for neuropathy work on really symptoms of blocking pain perception, right? Whereas alpha-lipoic acid actually works to support the root cause around insulin sensitivity and how the body handles sugar. So these are the four big areas that I see alpha-lipoic acid used for clinically the majority of the time, and all four areas tightly connected via the mechanisms that alpha-lipoic acid works on. So improved weight control comes secondary to decreased inflammation, antioxidant activity, and enzyme optimization toward improved blood sugar and fatty acid metabolism. So this leads to improved blood sugar control outside of just purely dietary choices made by the patient, which can lessen neuropathy severity and even improve appetite control and other metabolic areas, leading to easier weight loss and weight control. So there's many other clinical support uses for alpha-lipoic acid. While I don't see these as commonly for these conditions directly, it's important to note that ALA supports most of these through the same or similar mechanisms. So through strong antioxidant activity, by lowering inflammation and improving blood sugar control, it supports all these different organs and all of these different areas because they all suffer when you have poor blood sugar control and poor ability to absorb nutrients and sugar into the cells. So essentially they become starved, start to become damaged, etc., just like all the typical areas that we think of damaged by diabetes. So alpha-lipoic acid can really contribute to supporting health in all of these areas. So from PVD, glaucoma, MS through myelin sheath protection, hepatitis C and general liver support, support for various ways in HIV. Then we've got myopathy because it can support so much in the tissues there. And it's even got strong use in certain types of mushroom poisoning that it's really shown a very strong clinical application there. And then burning mouth syndrome and taste disorders, which we could kind of think of similar to tissue damage in the eyes or kidneys or other areas that we associate with advanced diabetes. It can support those through an enhanced insulin sensitivity and blood sugar and nutrient uptake. So here's looking at some random controlled trials of IV alpha lipoic acid for neuropathy, just to give some more specific examples. So the Aladdin 1 trial had 328 people and took patients through 3 weeks of IV alpha lipoic acid treatment versus placebo. And just to sum it up very quickly, in the results we can see the total symptom score actually decreased by anywhere from 58 to 63% in the alpha lipoic acid group versus only 38% in the placebo group. So a 70 to 82% response rate. And then you can see this quote from the people running the study: intravenous treatment with alpha lipoic acid using a dose of 600 milligrams per day over 3 weeks is superior to placebo in reducing symptoms of diabetic peripheral neuropathy without causing significant adverse reactions. So also appeared to be very safe for use. Then we've got the Sydney 3 trial with 120 people, so 14 days of IV alpha lipoic acid versus placebo. So in this one, they used a different type of measurement for total symptom score, but you can see still decreased by 5.7 points out of the 14.6 max in the alpha lipoic acid group versus only 1.8 points in a placebo. So a very significant p-value. And then neuropathy improvement score improved by 2.7 versus 1.2. So well over double, with again a very significant p-score between the two groups. So in this study, conclusion was intravenous racemic alpha lipoic acid, a potent antioxidant, rapidly and to a significant and meaningful degree improved such positive neuropathic sensory symptoms as pain and several other neuropathic endpoints. This improvement of symptoms was attributed to improved nerve pathology. So again, very promising use of alpha lipoic acid IV for neuropathy, which of course supports everything related to blood sugar control and diabetes, even outside of neuropathy. So administration options. Oral is very common and alpha lipoic acid is widely available, although it's only got 30% bioavailability. So depending on the severity of the patient's condition, it can certainly be worth going the IV route or combining IV with oral temporarily while they go through IV treatments in clinic, because obviously they'll have to come in and go through some kind of treatment protocol in clinic for that. We generally don't do subcutaneous or intramuscular or IV push. It's typically going to be recommended as an IV infusion, and that's because of solubility issues with alpha lipoic acid. It generally can't be mixed with anything else, as well as the hypoglycemia issues that can result from pushing or administering high doses too quickly. So for that reason, the infusion protocols are preferred. And for IV, there are many well-established protocols which we'll cover, but again, generally not recommended for push for those reasons: hypoglycemia, as well as just more risk of precipitation in those low concentrations. So testing and monitoring, this would really just be based on the patient's medical history and not as much on testing alpha lipoic acid levels. Typically, I don't see that done a whole lot, although there are tests that you can run for that. But more based on the patient's medical history, especially if they're obese, so looking just at their weight, their body fat percentage, their blood sugar profile, fasting blood sugar, A1C, all of those sort of metrics, depending again on their condition specifically. But those are the things you'll be looking to improve by use of a series of alpha lipoic acid infusions. And then side effects and precautions. Side effects are really very rare other than hypoglycemia, which is by far the most common and really to be expected, because by the mechanism of what we're trying to do with alpha lipoic acid, we're improving insulin sensitivity and blood sugar control. So compared to what the patient was experiencing prior, they are going to have much better uptake of blood sugar, hence hypoglycemia, until they get used to it, especially at higher doses. And if they haven't adjusted their diet, fluid intake, etc., to account for that. So hypoglycemia is really something that you're always going to want to educate your patients on as a possibility, just like with any other medication or regimen focused around lowering and controlling blood sugar, getting diabetes under control, those sort of things. You're always going to want to educate on hypoglycemia. These other side effects are rare at clinical dosing, but there are some low incidence of skin rash, GI symptoms, more commonly with oral administration. And then some precautions. So with Wilson's disease specifically, it should be noted that alpha lipoic acid does chelate copper, so that could require supplementation back in, for example, in a case like that. One report even showed 0 serious adverse events even after 75,000 different patient infusions of alpha lipoic acid. And again, with the most common symptoms being hypoglycemia, but also headache and sleepiness in those cases, probably mostly affected by blood sugar shifts. But just overall, very great safety profile. So now something you can really use in clinic. So popular clinic protocols that I've seen, most often I'll see between 100 and 250 milligrams of alpha lipoic acid infused IV, so IV infusion. And we generally don't want to give more than 600 milligrams per infusion because the risk of hypoglycemia is just too great at that point. But notably, there are protocols in the literature more specifically for peripheral neuropathy that go as high as 2,000 milligrams per day. But even in those cases, it's divided up 3 times per day and still not going above that max dose of 600 milligrams. But even the 100 to 250 milligram, or even pretty commonly, I'll see 400 milligram doses given per infusion. Those can still have a very positive impact on peripheral neuropathy, especially in combination with, improved diet and exercise and things like that improve weight control and blood sugar control. And this will typically be given in 250 mLs of D5W. It is most compatible in D5W, just because I know a lot of people will have this question. It generally can be given in normal saline, so 0.9% sodium chloride as well. It's just got the greatest compatibility in D5W, but by the time you're in the 250 ml bag or even in a 500 ml bag, it's not likely to precipitate out as long as it's given by itself. So generally administered over 60 to 90 minutes, and that just gives more time for the infusion to go, since it is better to mix it in a somewhat of a volume like the 250 mLs, for example, because it does have pretty poor solubility. And for that reason, we generally don't want to mix it with any other additives. So we generally recommend giving alpha lipoic acid alone. And again, just very important to educate the patient on the risks and the signs of hypoglycemia and what that will look like, because it will impact their blood sugar control. And for that reason, a lot of times it's a good idea, even if you want to try going to higher doses, so say you actually wanted to do even up to 400 or 600 milligram infusions, you would generally want to work your way up to that. So make sure the patient tolerates it well, especially on the hypoglycemia side for the rest of the day after the infusion. And I do want to note that IV push, intramuscular, and sub-Q again are not recommended due to those solubility issues with infusion, as well as increased risk of hypoglycemia concerns. So drug interactions with alpha lipoic acid, a lot of antipsychotic medications, alpha lipoic acid will potentially reverse the induced weight gain to some degree. So the weight gain with a lot of the antipsychotics is a really, really bad side effect, and it can really trigger the whole metabolic syndrome pathway. So really a good side effect drug interaction here. In those kind of patients, that alpha lipoic acid can really help through its mechanism potentially reverse to some degree or fight against that induced weight gain by improving that metabolic pathway and blood sugar control. And then, like I mentioned earlier in Wilson's disease, alpha lipoic acid is a chelator of copper, so that's just something to be noted if the patient has any condition related to that. So alpha-lipoic acid, in summary, very powerful support for blood sugar control, type 2 diabetes, and weight loss. Many other conditions as well, but those are the primary ones that I really see it heavily used in. And of course, peripheral neuropathy related to diabetes, depending on the severity of the patient. But overall, great safety profile if used within the parameters that I just discussed. So that covers everything I've got for alpha-lipoic acid today. Here's our contact information. If you've got any more questions, just please reach out, and we'd love to connect and help you get started. Thank you.